Okay. I'm going to be doing an IV push on my patient. The first thing I need to do is to check my physician order and compare that to my MARA. I'm going to check to make sure it's the correct patient on both the physician order and the MARA. So my patient is Janet Green, and okay, that matches on both. Her birthday is 4/13 of 1966, and that also matches on both. I could also check her armband and make sure it's the right patient with her birthday and her name, and ask the patient. I am going to check her allergies. She has no allergies, and that is written on both my MARA and my physician order. She is ordered to get 40 milligrams of furosemide IV push. That's every 8 hours. And I am checking both of them to make sure that they match, and they both do match. Okay. Also, like I said, go ahead and check allergies to make sure she has no allergies to the medication. All right, once I get that done, I am going to, before I do the IV push, I'm going to check the compatibility to see if she can even receive the Lasix with what she has hanging. She has LR hanging, so I will get my drug book just to check. So she is scheduled to get 40 milligrams, and that is a safe dosage of 40 milligrams. It can be given diluted or undiluted. Also, and that is to be given over 1 to 2 minutes. I want to check the back of the book to make sure it's compatible. And it is compatible with LR. Okay. I'm going to set that over to the side. All right. At this time, I will calculate how much I'm going to give my patient. So I'll get a pen, do my calculation. We're going to use a, let's see. So she should be receiving 4 milliliters, and that's going to be infused over 1 to 2 minutes. So make sure we do 4 milliliters. That's how much she'll be getting. All right, I'm going to go ahead and write out my information on my label. So I will put my patient name, which is Janet Green. She is receiving furosemide of 40 milligrams. I will put my date and the time. My name was prepared by, and the expiration date. I will get my equipment together. Okay, look at my Lasix. Check all my rights, make sure it is not expired, make sure it's the right medication compared to the physician's order. Check for any type of breakages in the seal or anything. Check to make sure there are no particulate or particles inside, and just to make sure it is the right medication. Basically, at this time, before I do anything, I can go ahead and educate my patient, let her know that with the Lasix, we need to make sure we check for renal function, make sure that we check for kidneys, let her know that it will cause an increase of urination, and she can lose some of her electrolytes through this. So we'll be monitoring her labs, like her BUN, creatinine, and like her potassium. So that's the educational part of it. Let her know that it is a loop diuretic. Go ahead, wash my hands. While I'm washing my hands, I can just be looking at her IV site. Checking for any, checking for any swelling, any redness, any leakage around the site. Ask the patient if they're having any pain or anything like that. Of course, hopefully they will go ahead and say no. I will go ahead and get my medication together. So, like I said, we're gonna be giving 4 milliliters. So I need to draw up 4 milliliters of Lasix. Okay. At this time again, like, even though I haven't given the patient medicine, I would ask again about allergies. Take this off. So since it's 4 milliliters, I would need at least a 5 milliliter syringe. Okay. All right. I'm going to draw up 4 milliliters of air. Okay, and I'm going to insert. This, I would pop the lid off and I would clean this for at least 15 seconds.
Your posterior, your anterior lung cells. You can just breathe normally through your mouth.
Insert. And draw up 4 milliliters. Okay. Check, make sure I got the exact amount I need, which is 4. I will go ahead and put that back over. And I'll go ahead and put my label on it. So that I would know exactly what it is. Okay. All right. I would check for patency of the IV site, which I would lower this down. I should have some kind of blood return in that. That'll let me know that it's actually still patent. Okay. After that, I'm going to get myself situated. I'm going to go ahead and put gloves on. After I clean my hands again.
Are you having any pain today, Miss Reed? On a scale from 0 to 9 to here. Okay. Now I'm going to touch your abdomen. How do you have abdomen pillows? Start up on that.
I'm going to actually use the port that is closest to the patient here, but before I use that, I'm going to clean the hub. Make sure the fluid is on. I'm going to clean this for 15 seconds. Okay. Get my medication. I'm going to take this part off. Dispose of it. Okay. Without touching. Insert. I'm going to clamp it and push 2 milliliters. All right, let go and wait a full minute until I give the second part of it, because I can infuse over 1 or 2 minutes. During this time, I would ask if there's any burning sensation, check for any swelling, edema, any leakage while that's going on.
No redness or noted on your feet. Do you mind rolling it down? Assess your back area, looking over bones prominences, make sure there's no redness or lesion.
And I can also use this time to continue to educate my patient.
Back area, no redness noted. Okay, you can come back. Are you comfortable in doing anything? Okay. Make sure my bed is low, locked, sides smooth. Make sure she doesn't fall.
Okay, after that 1 minute, I'm going to go ahead and push the other 2 milliliters. Going to clamp it,
I'm gonna say S1, S2 minutes,
push
and they simply take the failure for that.
my second part of the medication, which was second 2 milliliters, and I'm going to let it open it back up. Once I finish, I would discard this. And I'm going to sit here and watch the patient for a minute just to check for any allergic reactions. Continue to monitor the IV site. Once again, ask the same question. Are you feeling any tingleness, any numbness? Look for swelling, leakage, any type of redness or anything like that. I would, like I said, sit here and watch the patient for a minute. I would then go and write down my notes in my MARA, write down my patient information, the medication that they received, which was the furosemide, the amount, which was 40 milligrams, which equals to 4 milliliters over 2 minutes. I would put my time, the time that it ended. I would put how my patient reacted, put my nurse signature in my notes. I would leave the patient in a comfortable position. Make sure that their fluids are, if you know, whatever order they have for is their fluids, that they're back at the adjusted rate. And make sure that they're comfortable, that it's still patent, still flowing, and that completes my IV push.